Dr. John Drkulec, and I work with Arlington Orthopedics. I'm an orthopedic surgeon who specializes in arthroscopic surgery and sports medicine. I've been practicing with them since 2007. I originate from Canada, where I did all my medical training at the University of Ottawa, the sports medicine training at the University of Western Ontario, one of the most prestigious fellowship programs in North America. And initially stayed in Canada for family before I realized how futile performing good medical care in Canada can be for orthopedic surgeries, and opted to escape to the United States for greener pastures in Texas. With the nationalized healthcare system, one thing that people don't understand is that the budgeting is very constraining on medical treatments that are more expensive, and orthopedic surgery tends to be in the category of more expensive subspecialties. So where that is valued in the American healthcare system, it is very much discouraged in the Canadian one. And so that's the reason why people cannot get MRIs for 6 to 9 months, and they can't get surgeries for 6 to 24 months. Like a lot of orthopedic surgeons, I grew up playing different sports at fairly high levels, and as I was transitioning to the college years and debating whether I was going to play soccer or basketball, I tore my ACL and my medial meniscus, and that pretty well changed direction for me towards a course of medicine without playing sports. And so going through the whole process of being injured and becoming disabled with that injury, and this was before we had the most modern techniques that we're employing now, it really impressed upon me the impact these sports injuries have on athletes, and pushed me towards a career in sports injuries and sports medicine. So for 24 years now, I've been in practice. First year and a half in Canada, and then moving to Texas after that. My area of subspecialization is in injuries and surgeries of the knee and the shoulder. And so the most common things that we are going to see are people as they're entering into middle age and getting older, people who are jogging or twisting their knees, playing pickleball, tennis. We see a number of injuries like that. And the younger individuals are usually soccer players and football players. Injury prevention is a big part of my conversation I have with my patients, because I do believe that there are factors that come into play that are under their control to keep themselves healthy. And so having a healthy approach, both mentally and physically, to whatever they're going to do is really the key to trying to avoid injury. So getting adequate sleep, getting adequate nutrition, preparing fully for whatever they're engaging in, and making sure they're doing so for the mental approach as well as the physical approach. Same approach with them, only more intensively, because most of these kids want to play at a higher level and they want to stay fit, and they don't want to have an injury that's going to put them out for 12 to 18 months. And so one of the things that we saw a lot of in hockey, for example, is a great area where they've made huge strides in injury prevention. It's a very violent sport. And we used to see tons of knee injuries, ACL tears, meniscal tears, and you don't see nearly as many injuries in hockey like we used to, even though the sport has gotten much, much faster. And what they've done is, from a very young age, I have a son who's a hockey player at the collegiate level, and from the time he was 8 or 9 years old, they're instituting training programs that worked on movement, worked on core strengthening, worked on their flexibility, worked on complex movements and quick feet, and working out in the gym, such that once they're teenagers, they've made sure that as they're elevating the speed and the impact of their game with larger masses, that they're much less likely to get injured, even though they're playing at a much more intense level. With regards to common devastating injuries, I would say that in the knee it would be an ACL tear is the biggest concern I have. Behind the ACL tears would be, there are certain meniscal tears that can be devastating to the health of the knee and can be unrecoverable and lead to rapid arthritis. With regards to the shoulder, I would say the most common concern we have is rotator cuff tears. The approach that we take to patients who suffer any of those injuries, we really want to focus on adapting the body to protecting the joints in an effective fashion. And so it is a comprehensive approach in terms of optimizing their diets, optimizing their sleep habits, working with physical therapists to deal with the different factors that come into developing better control of your joints and balancing out your whole body so that you're not relying just on those joints for certain movements. You're optimizing all of your joints for better, more effective, and safer movement. When we were growing up, we all heard that song, the hip bone's connected to the knee bone's connected to the ankle bone. And there's some truth to that in terms of our movements as human beings are very complex. It's a three-dimensional controlling movement where if one part is off, it throws off the next parts that much more. And so optimizing those movements of the different joints is really the focus. And what we'll tell patients is the core of your body is the key. And the more you can strengthen up your stomach muscles, your hip muscles, your back muscles, and optimizing your pelvic position, optimizing the flexibility and movement of your hips, the control of your hips, and building up your thigh muscles is what powers you with walking, with jogging. It powers you with using your upper extremities, because the weaker those muscles are in your core, the more stress on the joints elsewhere. From a surgical standpoint, we keep refining our techniques. And for example, when I had my ACL reconstruction done in 1990, I was unfortunate enough to have somebody who was trained in 1973 techniques do the surgery. And so there was a reason why I was not capable of returning back to playing high-level sports after that injury. That is no longer the truth of ACL reconstructions. We have refined the techniques so much so that we're able to take professional athletes and get them back up to where they need to be successful in the NFL level, for example. And it really comes back to the rehabilitation after the surgery. Our surgical techniques have been slightly tinkered with over the last 15 years, but it's not very different from what we were doing back in 2000. But the rehabilitation approach and techniques is where we are making the most of the recovery process and making sure people don't fall off of the track back to 100%. The speed with which we get people into rehabilitation, the understanding of what things we need to hold off from, i.e. jogging, and what things we need to accelerate in terms of stretching, flexibility, coordination, balance, agility, quickness, and then of course weightlifting and strengthening. Back to the core, I would always recommend to patients to consider integrating something that they enjoy but covers the territory that we mentioned in terms of working on their flexibility, their coordination, their balance, stretching. So things like yoga, Pilates, Tai Chi are all incredibly helpful, a lot more helpful than people appreciate. And so that's one of the things that I always strongly encourage my athletes and anybody aspiring to be very physical to get into. And even just having a pyramid approach to bettering their bodies. Number one at the base is really flexibility and stretching. And so working on the flexibility of your muscles by stretching them, working on the flexibility of your hips and your knee will help to protect and increase the longevity of those those joints. I will see patients with severe arthritis, but if they have been working diligently to work their shoulder flexibility or their knee flexibility or their hip flexibility, their arthritis can be severe bone on bone on the x-rays, but those patients generally are doing pretty well and do not require a joint replacement imminently. Whereas patients who rapidly require a joint replacement are the ones who have allowed the inflammation to really shrink the capsule of their joints, tighten up their joints, which increases the forces across the joint space. And those are the patients that end up requiring a knee replacement or a hip replacement or a shoulder replacement. And it's low-hanging fruit. It's the easiest thing to do physically. It's the easiest thing to teach. It's the easiest thing to add into your daily life. So that's number one. Coordination and balance is number two. So working on doing one-legged exercises, on using balance boards or Bosu balls. That's the second most important thing. The third most important thing would be the strength, so weightlifting. And not only technique, but also nutrition. And so most people do not take in enough protein in their diets. And so I'm always pushing my patients to up how much protein they're taking multiple times a day so that they can hit, minimum 75 grams a day, preferably 100 grams per day. If they're weightlifting, they should be doing 125 to 150 grams per day. And the hardcore athletes are doing 150 to 200 grams of protein a day, that's a lot of steaks. There are many forms that you can get protein. The easiest is going to be having fish, meat, chicken, steak. Eggs is a wonderful source of nutrients and protein. Nuts is a good source of protein as well. With regards to osteoarthritis, I will typically recommend to patients that they give an opportunity to take something like glucosamine and chondroitin sulfate, which are the ingredients in OsteoBiflex. Using turmeric is something that has been proven in many studies to be beneficial for many patients with arthritis. Ginger root is another extract that many people find does help with their arthritic symptoms. So on the naturopathic side of things, that's what I recommend. For all patients, I will recommend vitamin D3 with K2. And generally, 5,000 units of vitamin D per day is healthy for your immune system and for your bone health. And so for patients who are potentially looking at a joint replacement in the future, optimizing how strong their bones are is going to be very important. And taking vitamin D is a major step in that direction. If you are having healthy kidneys and you're having a well-balanced diet, generally speaking, I don't think that calcium supplementation is absolutely necessary. The vitamin D is probably a more important part of that equation. And with regards for muscle building, besides the meats that we talked about and fish and eggs, I also recommend to patients that if they have trouble with that, then getting whey protein or other kind of protein powders can be helpful as a supplement to their meals to get the necessary grams of protein. You really need to have enough protein in your diet in order to build muscles, and if you're not getting enough protein in your diet, your body will catabolize your muscles to get the protein it needs to function. That's not desirable. And there are certain vitamins that have been also shown to help generate muscle tissue if you're going to be working out. So creatine, I strongly recommend everybody should be on creatine, and it's been shown to help with clarity of thought as well as building muscles. So all the studies have shown that taking creatine builds muscles more effectively. There was a scare about how unhealthy it was back in the 80s when people were taking probably 10 to 40 times the recommended dosage per day. And certainly that will overload your kidneys just like anything will if you're taking that much. But used as directed, or even if you double up, is completely manageable for your kidneys and is not detrimental. The other supplement that I strongly recommend for everybody's health mainly from a selfish standpoint of wanting them to build more muscle more quickly, is omega-3 fatty acids. And I'll usually recommend either Carlson's or Barlean's omega-3 fatty acids. And they should take 2 pills with an early meal in the day and 2 pills with a later meal in the day. It's only absorbed with taking it in with a meal, just like vitamin D. And studies have proven that when you get an injury, if you've been taking that regimen of omega-3 fatty acids, you will lose your muscle much more slowly than if you're not taking it. Also, when you are on workout regimens, you will build your muscles and get hypertrophy of your muscles 20 to 25% faster than if you're not taking those medications. So omega-3 fatty acid, as well as being very healthy for your cardiovascular system, is very healthy for your muscles. Absolutely. The gut microbiome is extremely important to your personal health, and there's a lot of truth to the saying that you are what you eat. What you eat changes what your gut microbiome makeup is. It shifts according to what your diet is. And people who eat a lot of carbohydrates, a lot of junk food, a lot of chemicals, a lot of processed foods, the microbiome shifts, and it has 2 effects. When you shift into that diet pattern, it actually tricks the products that the bacteria produce actually does go to your brain and encourage you to continue eating that kind of food. And if you change your diet, your whole microbiome will change. Those other foods that I mentioned, the carbohydrates, the sugars, the processed foods, the chemicals that are found in so many of the junk food that we eat every day, those also aggravate the bacteria in your intestine to release chemicals that cause damage to your lining of your gut. And that causes inflammatory products to seep into your bloodstream and increases the amount of inflammatory reaction that your body has. And that causes more pain in your joints. And so patients who switch to a keto diet, to a low-carb diet, to a healthy, well-balanced diet, to a carnivore diet, to intermittent fasting as well. These are all geared towards trying to manipulate the microbiome to produce less inflammation in your body. And most patients who adopt that approach will find within a few weeks that their joints hurt significantly less. Explain to the young athletes. In the older athletes, we have to push them to be stricter and to be wiser with their choices. And trying not to eat within 2 or 3 hours of going to bed at night, eating too close to going to bed, it does disturb your sleep. Your body has to direct too much energies towards processing the food in your gut, as opposed to just letting you rest and recover through the night. The message I would like to get out there is that it's never too late, that you will always see improvements if you start instituting these changes to your life. Your body will always appreciate these things, and it's important to start small and build up from there. So, having a course of physical therapy, you get to interact with the professionals there. For people who want to get into Pilates, I generally will, it gets expensive, but if you can do 5 private lessons with a good instructor who can truly teach you how to do the different exercises, from there, then you understand what you need to do, and you could transition into a group Pilates, which is much, much, much cheaper. The beautiful thing about yoga and some of these workouts is that you have online resources, and you can put it on your laptop or hook it up to your TV and watch YouTube videos of yoga instructors showing you what you can and should do. So that's very beneficial. The other wonderful thing that I'll mention to my patients, going on Instagram and looking up knee physical therapy, looking up shoulder physical therapy, you will find, or core strengthening, hip mobility, you will find many physical therapists putting very high quality short videos on what you can be doing, that you will always find a series of exercises amongst the dozens of videos you watch that you can easily do on your own. and smooth and controlled, focusing on technique. When it comes to strengthening with weightlifting, just light weights, studies have shown that you don't have to do heavy weights. You just want to do perfect technique and do enough repetitions that you're getting within about 2 or 3 repetitions of not being able to do another one. And if you're getting within 2 or 3 repetitions of failure, that's enough to grow muscles. And whether it's with a 5-pound weight that you can do 40 or 50 times, or you're using a 25-pound weight that you can only do 10 times. Get good sleep. Do what you can to get good sleep, whether it's changing your diet, using supplements. There are a couple of sleep remedies on the market that I'm a fan of. Like Dr. Parsley's sleep remedy is one that contains many different components that are all natural and have each on their own been shown to be beneficial for helping quality of sleep and leaves you with no hangover in the morning. So some people try to use melatonin. For most people it's not effective, and that is but one of 6 or 7 or 8 different components in that medication. That's an over-the-counter treatment. Meditation is another one that helps put you in the proper mental mind space for sleep as well as just for living in general. And so developing a strong positive mindfulness outlook on life is important to be able to max or optimize your sleep.